As Methodist Healthcare Ministries celebrated its 25-year history, it recognized opportunities to deepen the impact of the work it's been doing across South Texas. By sharpening its focus on health equity, Methodist Healthcare Ministries seeks to improve the health and well-being of both the people and places it serves. Health equity is the lens through which Methodist Healthcare Ministries seeks to reduce systemic barriers to health by supporting resilient individuals and families. This video series focuses on each of Methodist Healthcare Ministries' 7 regions, sharing community voices whose stories shed light on the history of inequity in those regions, and the people and partners who are making strides to change it by going on a journey from charity toward equity and building self-sustaining, thriving communities.
Kerrville's been it's been an awesome community. It's got a nice slow growth pattern. The Doyle community was one of those communities where it really did not mix with the rest of Kerrville, but those walls have come tumbling down. Looking at the streets, looking at the old buildings, when you drove through there, you knew you were in a different part of town.
When I arrived here in 2012 and kind of got to know the community, there was a huge gap between this community and the remainder of the city.
At one point, the blacks that were here in the city of Kerrville, they lived in houses behind the houses that they served, the families they served, and so forth. And somehow, the idea came in the white community, you all need to move over here, which was called the settlement, now called the Doyle.
We had 7 juke joints, and all 7 juke joints did well. There weren't enough minorities in the community to support all 7, so they had to come from outside of the community. And this community has always been an integrated community, and it's always been a community that was willing to help.
We had restaurants, and we had a big gym here where the pavilion is now for the kids to play, and the Kerrville Park was more family oriented, and now it has changed.
After the businesses left, the community took a lull, but simply because the community couldn't produce, it didn't mean that the people weren't producing. The people kept that same energy. They kept that same love for community, and they believed in helping each other just as they did before integration.
But there began to be a mix of Hispanic and Black and Anglo. So you've got a community here that has a history to it. Not all that history is good in the sense of how it got started and discrimination and neglect and everything else. But it was a strong community. When we ask people, what do you like about this community? They would say, I feel safe here, I know my neighbors, and I can walk to the store.
We have such a close-knit community, partnerships and organizations working together to benefit and solve health inequities.
Being part of the Build Health Challenge, part of the healthiest cities and counties, has brought a great deal of awareness.
Beginning with a survey of the community, 14 neighbors in the community went door to door asking 3 questions. What do you like about your neighborhood? What are your hopes and dreams for this area? And what do you see as the greatest needs? And so one of the needs that came out of that was, they said, we wish we had a place that we could meet and kids could have activities and we could have education programs and so forth. You've got Hope for Health that is fantastic and a great model. And I'm glad the city has come in with funding. Primary funder is Peterson Health.
We were approached by Teresa Standage and by Brenda Fudge, who talked to us about this concept of the Build project and what it could look like in serving the Doyle community. And what had to happen to be able to have the Build project successful is they had to have a partnership with a hospital.
Through Hope for Health, we have several avenues to help people. We have medical.
That has been tremendous. People have been using that, and they're good about keeping their appointments and just being helped with a blood pressure check, diabetes check, or if there are other issues, being able to be given information as to who to call or where to go for that assistance. I see that as a great improvement out here in the community and a great help.
We've gotten grants to be able to help with dental.
I was still being in a lot of pain and struggling. I had my mouth fixed, my gout, medicine for my gout, medicine for my head where I had big bumps coming on it.
I'm really grateful for the food bank that I have up here. I had a lady next door to me. She didn't go to food bank. She had nobody taking her, and I asked my grandson, but I guess she was ashamed.
One of the things that we were doing is we were doing the home deliveries, and San Antonio Food Bank at the time we don't really, that's not something we do. And so they listened though. I said, well, it is a real need. And if you're telling me that I'm not going to be able to take San Antonio Food Bank food to someone that lives out rural that has no working transportation, or they're a caregiver taking care of someone and they can't leave their home. So now they've allowed us, and there are 16 rural counties are allowed to do home deliveries.
When I arrived in this community, our church had this land and it was being underutilized. And I raised the question to the congregation, how can we use this land to glorify God and be in fellowship with our neighbor? And we took the assets that were available to us, faith, grace, and prayer, invited others to come and partner with us on our journey, and Glory Community Garden was born.
And that Glory Community Garden is a space that have brought people together from all walks of life. They're there together and they get to socially interact with each other. They get to learn each other's story, and they'll find out that, hey, he's just as human as I am.
We improved relationship with the police department, the fire department, and started to work toward achieving some goals to improve the quality of life for the residents.
Across the street, they just put these sidewalks in with the last 2 weeks, leading to the park. They're going to do road work out here that's been badly needed. But you have the officials in the city and the county who see the need and willing to put forth the effort to help.
Why do you think the city officials are now starting to help? Is it because there's a push for it?
Man, that's a tough question. I think they've just been touched. It's first of all by the Creator, and anytime a man opens up his mind and his heart, and he sees that there's a need, then he has a need to help. And I think that's what it is. I could be in left field somewhere, but at least that's what I choose to believe.
Listening and then bringing folks to the table, and especially the neighbors, and then resources in the community. Okay, what can we do? How can we do it?
We got more people coming out volunteering at the Doyle School, which historically you didn't see that, okay? And we were able to petition the city to use some 4B sale tax money to help improve the quality of the building, to provide some amenities that were missing so that the center could be a better place and provide services that the people in the community could use. So then they went to the park and made some improvements in the park. So those efforts were not just a Band-Aid effort. City staff was on site. They communicated with the people. It kind of let the people know that we are aware you're here, we're aware of your problems, and we want to help solve them. We want to partner with you, okay? So we still have a ways to go, but it's a good start. It's a good start. In a community where people wouldn't even talk to each other, now they're working together side by side because they have a cause, they have a mission. They're being a part of something greater than themselves. And that always challenges us. And it should bring out the best in us. So I've seen that happen. In the 10 years that I've been here, I've seen more resources poured into this community. You know, I've seen more people coming to the table asking what they can do to help. And I've seen the community itself respond in kind.
My hope for this community is a more positive attitude from the people, and I would love for the people residing in this community to be more cognizant of health issues.
My hope for the community is that the people will latch hold of the dream of keeping a community, the dream of community growth, the dream of getting an education so my family and my family members can thrive, the dream of keeping spirituality in our lives, the dream of dreaming is my hope for this community.